has been the Chief Executive Officer of the Central Region Apollo Group of Hospitals, Chief Executive Officer of Apollo Hospitals Hyderabad, Vice President of Apollo Hospitals Hyderabad. He has created a platform and provided the impetus for establishing emergency medicine as a specialty leader. He's an anesthesiologist. Provided the platform to establish the first operational health city in Asia, Apollo Health City Hyderabad. He has also intuned a leadership for the team that took Apollo hospitals through various accreditation programs such as the JCI, the NABH and the NABL. Consistently providing new solutions for sustained growth and creating healthy margins for Hyderabad division of Apollo Hospitals has been his call. He has been promoting innovations in clinical care, patient services, marketing and performance management across the region. I would like to invite Sir to please give us a few words today and encourage all of us to adapt to a new this.
Honorable Governor of Telangana and Lieutenant Governor of Pondicherry, Dr. Mrs. Soundararajan. Permit me to address you as Mrs. Soundararajan because we are very fond of Dr. Soundararajan, who is a colleague of ours at the hospital. Dr. Bhandari, Dr. Ruma Sinha, Dr. Yogesh, ladies and gentlemen. It's very fortunate to have in our midst a truly multifaceted personality. She's a doctor, a gynecologist, a politician, now the governor, and above all, a great human being. We've seen many individuals with multiple facets, but very few have excelled in all the facets that they have. And ma'am, you're one of them. It's a privilege to be here in your presence today. Dr. Bhandari, again, the champion of robotic surgery in India. You're again another multifaceted personality, a urologist of excellence, an academician, and now the champion of technology. Good to meet you after many years, Dr. Bhandari. You don't seem to change, you don't seem to age at all. Many years ago, when Dr. Reddy, as Dr. Bhandari just said, when Dr. Reddy, he takes decisions in minutes and somehow when it is new technology, he doesn't even think about it. He decided to get the Da Vinci systems into the Apollo system. We were all thinking that it would be urology that would be the lead specialty and they would be taking the major part of the Da Vinci system, time of the Da Vinci system, or the surgical gastroenterology. But success comes from unexpected quarters. And it did come from unexpected quarters because in Hyderabad, it was a lady, a small, tiny, young lady who took the lead and made a huge difference with the Da Vinci system, and that is Dr. Ruma Sinha. Dr. Ruma, the whole country is proud of what you've done with the robotic system, and we are extremely proud. And you are, not just with what you achieved, but what you're going to achieve in the future. Congratulations, and we are all the way behind you, not just within the Apollo system, but beyond the Apollo system with whatever the new technology can offer to the patients, because ultimately it's the patients who need to benefit from the new technology that's coming in. I would like to conclude by thanking the faculty and the delegates for being here today, as I believe that history is being actually created today with the launch of this association. And Dr. Bhandari, let me assure you, this will be an academic platform and will be an academic platform. Thank you and all the very best.
Thank you, Dr. Hariprasad, for your encouraging words. Our chief guest today is unique in terms of being a gynecologist herself. She has started her career as a medical practitioner, completing her MBBS and post-graduation in gynecology and working before she left it for her political career. She has a remarkable public and social service background spanning over almost 20 years. She nurtures great devotion towards public service and enhancement of living standards of common people with focus on health and education as a prime agenda. She has donned the hat of being a state head of a political party and steering it with exemplary management skills and pro-people service milieu. Dr. Tamilisai Soundararajan is a proud recipient of an international award titled International Rising Star of the Year 2018 by Multi-Ethnic Advisory Task Force USA under US Congressman Danny K. Davis for her services to the society, especially in the field of politics, public and health services. Dr. Tamilisai Soundararajan is known for a strong advocacy towards upliftment living standards of people through better health and preventive care. She is a great admirer of social and cultural strengths of our country and very considerate towards inclusion of values and humility right at the basic education system and upwards. It is indeed an honor, ma'am, to have you here as our chief guest because you are not only a champion of betterment of women's health as well as you are a gynecologist and you understand how important it is for us to be able to do better surgery and work as we can through technology. I would like you and our dignitaries to launch the society. So ma'am, we are starting the first ever association of Gynaecological Robotic Surgeons of India, and I would like to request the chief guest to please inaugurate the same for us. The association was started, ma'am, with the idea that we should promote newer technology as well as bring all gynae robotic surgeons together in a single platform so that we are able to get better academic progress in this particular field. I would request you to please say a few words to all of us to encourage us.
A special good afternoon to each and everyone here. Dr. Ruma Sinha, President, Association of Gynaecological Robotic Surgeons and Organization, Chairperson, RoboGynIndia 2022. Dr. Rama Joshi, Vice President, Dr. Anushmala Shukla, Kulkarni, Secretary, Dr. Anupama Bagadur, Joint Secretary, Dr. Yogesh Kulkarni, Treasurer, Dr. Mala Srivatsa, Joint Treasurer, Dr. Mahendra Bandari, the Padma Shri Awardee. Sir, after hearing your words, I am really very much surprised that you practiced in Puducherry for a few years, and I am really such a good coincidence that you worked in JIPMA for 9 years, I heard. So as Lieutenant Governor of Puducherry, I thank you for serving that premier institution of that Indian territory, because definitely the students would have benefited by your great teachings. And Dr. K. Hari Prasad, President Apollo Hospitals, and when he was mentioning, he wanted to mention me as Mrs. Soundararajan than Mrs. Tamilisai Soundararajan, because he told we are more attached to Dr. Soundararajan, who is my husband. I told, not only you are attached, I am also attached and I am also very fond of him. He was telling, we are very fond of him. I also fond of you, no problem at all. So in a lighter sense I told, because I am really very happy to share the dais with Dr. K. Hari Prasad, the President of Apollo Hospitals, and Dr. Walter from Canada, and Dr. Gabe from USA, and all the young friends who have assembled here, and all the eminent personalities. And when Dr. Ruma Sinha called me to inaugurate this program, as we are celebrating the Azadi Ka Amrit Mahotsav, we are having various types of programs, and almost I had a very tight schedule. But when she came and asked my presence here, I no other go, I just accepted because we are all in the same fraternity, so I cannot deny your request. And apart from that, that is the only honor I could do her, so that she is doing such a great job, at least to attend the conference, to inaugurate it. So that is a small compliment which I can give to her. Her exemplary service, as it is mentioned by Dr. K. Hari Prasad and Dr. Mahendra Bhandari ji. It is not easy to initiate one new technology, we know. Actually, when I was hearing the words of Dr. Mahendra Bhandari ji, my thoughts went back 40 years back when we started practicing ultrasound and fetal therapy. 40-45 years back, interventional ultrasound was not thought of. So when we came forward saying that we will aspirate the ovarian cyst or some of the procedures can be done by ultrasound, nobody will accept. But we used to go and convince them. And particularly 40 years back when there were no very defined books on ultrasound, we used to diagnose some cases and run to the theatres to see even immediately after opening, changing the dress, and to see how it was so that we can correlate the findings with the next patient. So like that we used to go and study. So I can understand the difficulty how Dr. Ruma could have faced in initiating this very new technology. And another thing, in our country, as it is said by Dr. Bhandari, it is patient oriented. So whatever may be, the success should be there. Even the highest technology applied, and if there is a small complication, even though we are confident of applying the same technology in the next patient, definitely we won't be able to do that. So it is very difficult to practice because it is patient oriented, and the patient nowadays with the Google and all the other things, we won't be able to convince the patient. So it is the greatest job she has done, and I compliment you, because and another thing, as a gynecologist, not only as a governor, as a gynecologist, I am really complimenting you. And I know personally how it is very difficult. For example, some of the incidences when I say about my initial practices in ultrasound, even the smallest things we won't be able to convince. For example, once one patient came for a prostatic study, then I told, come with full urine, morning, I have to study your prostate. He came and opened an yellow bag, 4 bottles of urine he kept on my table and told, you asked me to come with full urine. One day full urine, so I came with full urine. So this is the type of, so we have to make the patient aware of the situation. Even the smallest thing, we won't be able to make the patient aware of the situation. And as it is said, that is less invasive, cost effective, cosmetic. So when Dr. Bhandari said it's very difficult to propagate it. Not only he was telling as a urologist, it's very difficult to propagate it. I know as a nephrologist, when I'm a half nephrologist, Dr. Apollo, he must be, Hari Prasad must be knowing, because initial days, I used to go and assist him for catheterization and for AV fistula, everything I used to go, because and after by ultrasound we were able to focus, and we were able to, ultrasound guided some procedures we were able to do. So some guided procedures I am very well aware, but the acceptance, it's very difficult to create the acceptance in the initial stages. And as a gynecologist, women are more focused on cosmetology purpose. So it is this, when we propagate it, whether it is any other purpose, if it is for cosmetic purpose, then definitely they will accept. So one positive point you have, the robotic surgeries for cosmetic purpose, because when we initial days, we all know, when we wanted to propagate breastfeeding, when we say it is nutritious and it is good for the baby, it is good for the mother, no mother accepted it. When we said So you will become very beautiful after giving breastfeeding. So everyone started. So even when I celebrated the breast milk day last year, you won't believe, all were looking very beautiful. The women were looking very beautiful, and they were telling, because of that, because when we learned that we will become beautiful and we will lose our fat very easily, so we started giving breastfeeding. So you can propagate that, whatever may be the situation, your cosmetic purpose will be there, and cost and cosmetology, both are there. And cost effective because the stay will be less, and with all our complications will be there, less hemorrhage and everything. What all, as a practicing gynecologist, they can highlight more on things. And technology, because nowadays the technology plays a very important role, whether it is artificial intelligence or whatever may be the augmented reality or virtual reality, the 3D printing and robotics have changed the face of medical practice. And the goal of our Honorable Prime Minister Shri Narendra Modi's digital health mission is to make healthcare delivery available, inexpensive and accessible for everyone, especially the poor who reside in remote and difficult to reach areas. And not only it's cosmetic, and as I said, the complications are less and innovative. These conferences like this will make us to interact with each other, so that the experience we share will help us to face the challenges in the procedures which we follow. So I'm really very happy to attend this program, and my appeal is, because as a gynecologist, as medical professionals, we always encourage research activities and publications. And I always felt that I was practicing sonology for more than 10 to 15 years, and I am one of the pioneers of sonology. And I have done lot of procedures.